All right, in this module, we'll have a simplified approach to a patient with ataxia. So ataxia, the term is derived from a Greek word, ataxis. Taxonomy, yes. So this term means without any order. Okay, so ataxia is essentially an impaired coordination of voluntary motor activity. And the symptom of ataxia is often described by the patient as a sort of unsteadiness or imbalance. Now remember, this may be a true ataxia or an apparent ataxia. Okay, so there are certain ataxia mimickers. See, when you have a patient with some sort of a proximal muscle weakness. So when there is a proximal muscle weakness, now this can cause some sort of unsteadiness while the patient walks. And this may be misinterpreted as an ataxia. Okay, even patients with hemiplegia, when they are having a mild sort of weakness, they might also say that, I'm having some sort of unsteady gait. Okay, so please understand that you've got to differentiate the true ataxia from apparent ataxia. Okay, right. Now, in a patient with ataxia, when you try to localize the lesion, what are the possible sites of lesion? So the possible sites of lesion in an ataxia are, number one, cerebellum or its connections. What do you mean by the connections? The peduncles. So this is called a cerebellar ataxia. Cerebellar ataxia. Okay. And patients with cerebellar ataxia will have features of cerebellar dysfunction. Okay. In addition to the ataxia, you will have other features of cerebellar dysfunction. Then other possible sites of lesion, number one, large fibers of peripheral nerves, dorsal root ganglion, posterior column, medial lemniscus. So in these four sites that I've just discussed, what is happening? There is a proprioceptive defect. Now when there is such sort of a proprioceptive defect, it can result in a sort of sensory ataxia. Okay, sensory ataxia. So this is usually accompanied by sensory symptoms. So along with the ataxia, the patient will definitely have some sort of sensory symptoms. And among these sites, okay, you will still have certain differentiating points. Because if you have got a lesion involving the large fibers of peripheral nerves or dorsal root ganglion, so in this one, as well as the dorsal root ganglion lesion, the deep tendon reflexes will be absent. Okay, in the first two. Whereas when there is a posterior column lesion as well as a medial lemniscus lesion, the DTR will be preserved. Okay, because the large fibers of peripheral nerves and dorsal root ganglion, that is a part of the reflex arc. Okay, so when there is a lesion involving those sites, the deep tendon reflexes may be absent. Okay, so these four sites, that is called a sensory ataxia. Then frontal lobe and its connections may be affected. That is what is called frontal ataxia. Okay, especially when there is a lesion involving the frontopontocerebellar fibers. And you can have the vestibular system being affected, which would result in a vestibular ataxia. And this is usually accompanied by vestibular symptoms. Okay, so these are the possible sites of lesion. Okay, right.